Esophageal atresia is a condition where the esophagus does not develop properly before birth, leaving a gap between the throat and the stomach. This means food cannot get from the mouth to the stomach, leading to the inability to eat. Often, but not always, there is an abnormal connection between the esophagus and the airway called a tracheoesophageal fistula, or TEF. Sometimes the windpipe or breathing tube does not work as well and can lead to difficulty in breathing. Esophageal atresia is complex and may involve additional problems with the heart, kidney, urinary tract, intestine, and spine. The team at Connecticut Children's will evaluate your child to discuss specific options with your family based on the type of esophageal atresia your child has. Usually symptoms are present shortly after birth, including the inability to feed, trouble breathing, choking or coughing while feeding, excessive drooling at birth, bluish skin tone in severe cases of respiratory distress, and the inability to pass a tube down the esophagus. Typically, esophageal atresia is treated with surgery shortly after birth. Some children may need more than one surgery to correct the problem. Treatment depends on the type of esophageal atresia and how serious it is, as well as any other medical problems identified at birth, like heart, intestinal, or urinary problems. If the two ends of the esophagus are close together, the surgeon may be able to connect them with surgery. If the ends are farther apart, your child may need a delayed surgery to lengthen, stretch, or replace the esophagus before the ends can be connected. Some children may need a temporary gastrostomy tube, a feeding tube inserted into the stomach until the child is able to eat by mouth. The Esophageal Atresia program at Connecticut Children's includes a team of specialists that meet your child at birth and remain with your family throughout this lifelong process, beginning at conception and continuing through long-term outpatient care. They are currently at the forefront of discovering new treatments for kids with EA, leading a national multidisciplinary study while developing evidence-based practice guidelines to steer future practice. Your Connecticut Children's Care team will help you determine what's right for your child so they can live their healthiest life.